All right. Good afternoon and hello, everyone. Welcome to today's event, Nurses on the Front Line, Models for 2020 Flu and COVID-19 Vaccines, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleague, Sarah Price, Deputy Director of Public Health Integration. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either using computer audio or physically dialing in. All attendee lines have been automatically muted and will be muted for the duration of this event. The duration of this event is approximately 60 minutes, including introductions, presentations, and a live Q&A. Again, the duration of this event is approximately 60 minutes, including introductions, presentations, and Q&A. We highly encourage you to use the Q&A box today. It's located in the lower right-hand side of your computer screen. You may have to expand the panel in order to open it. This Q&A box will be open for the duration of this event, and at any time, if you have any comments, questions, or concerns, or even just a shout out to our presenters, we encourage you to use this box. Simply open the panel, type your question, select all panelists, and hit the send button. Again, open the panel, type in your question, select all panelists, and hit send. All panelists will see your questions, and again, we will be answering those questions at the end of today's event during our live Q&A session. Friendly reminder, today's event is being recorded. All attendee lines have been muted and will be muted for the duration of this event. The Q&A box will be open for the duration of the event, again, located in the lower right-hand side of your computer screen. Questions will be answered during our live Q&A session, and if for some odd reason we cannot get to your question in the time allotted, we will make an attempt after the event is completed. With this being said, I'm going to turn things over to my division colleague, Sarah, who will be taking it from here. Sarah?
Thank you, Liz. Good afternoon, everyone. Thank you so much for tuning in this afternoon and joining us. Again, my name is Sarah Price. I work at NAC in the Clinical Affairs Division. I've been a community health nurse myself for about 15 years, so it's my joy to help with this session today and kick it off. We're so grateful that each of you have taken the time to tune in and explore with us the role of nurses at the front line. Many of you know that we've been celebrating 2020 Year of the Nurse, deemed by the World Health Organization for this year. And through the conversations we've been having with nurses, we've been hearing numerous accounts of nurses leading at the front lines of care. So it's no surprise that 2020 flu season and now the planning for the COVID vaccine is very much influenced or led by nurses. The 28,000 nurses in health centers have always played a key role in public health, preventive medicine, and addressing emergent needs. Nurses always bridge the gap between policy, science, implementation, safety, and patient-centeredness, and this time is no exception. During today's webinar, you'll hear from the experts at CDC, the Association of Immunization Managers, and the Bureau of Primary Health Care as they lay the foundation for just where we are in flu season and the COVID crisis as well. Our aim is to provide the most up-to-date flu vaccine science to practice and to prepare for the upcoming COVID-19 vaccines and be able to microplan for that. Following those experts, you'll hear from three nurse leaders, Mary Blankston of CHC Inc., Anthony Fortenberry of Callan Lord, and Nate Pena of Esperanza Health Center, as they lead you in our focus of the day, which is exploring nursing models from health centers as they address the flu season, including microplanning, patient engagement, and patient and staff safety. Thank you again for joining, and please engage with us, as Liz said, putting questions or comments in the chat as the presentation goes along. Again, thank you for joining us. Next slide. So our agenda today, again, I just reviewed, but we'll hear from CDC first, the Association of Immunization Managers, HRSA VIPIC updates. Then we'll hear from our three presenters, have Q&A, and then let you know of some additional opportunities to learn more about the work being done. Next slide. Here is our list of speakers. Their bios will be provided along with the recording after this, but we will begin with Captain Amy Parker Feeblecorn of CDC, Claire Hannon of AIM, Jennifer Joseph from VIPIC. Then we'll have Anthony, then Mary, and Nathan from our health centers. So we are sure you will enjoy hearing from them as we have as well. Next slide. So we'll begin first with Captain Amy Parker Feeblecorn as she shares some of the CDC updates. Amy?
Great. Thanks so much, Sarah, and thanks for the opportunity to speak a few words on our call today. So for your awareness, CDC has been able to purchase an additional 9.3 million adult flu doses that will be available late in the season. And it'll be especially important that the influenza vaccination season be extended this year in order that we can use all 9.3 million doses. State and local immunization programs were encouraged in a joint letter by NAC as well as the Association of Immunization Managers for state and local immunization programs to collaborate with community health centers in their jurisdictions in order to use these supplemental adult flu doses. And it's because of the important role that all of you play at community health centers in reaching adults who otherwise might not be vaccinated that this partnership is really encouraged. In anticipation of all these flu vaccination activities that will be occurring during the pandemic, CDC has developed guidance for safely providing immunization services during the pandemic. The guidance can be found online. It's titled Vaccination Guidance During a Pandemic, and it has recently been updated, and the revised version will be available either later today or tomorrow, but it addresses situations for providing influenza vaccine in healthcare and congregate settings. And finally, I wanted to mention that CDC would like to highlight influenza vaccination success stories and vignettes of successful models that have worked for increasing flu vaccination coverage in the context of the pandemic. So these influenza vaccination success stories can be used as lessons learned for COVID-19 vaccine implementation and can be shared with state and local immunization planners. And I know several of you will be sharing your success stories today, but if any of you on this call have a model or a success story to share, please feel free to reach out to us so that we can highlight your story and your successes. Thank you.
Thank you so much for sharing, Amy. Along with the slides that will be available after this webinar, we'll definitely be sharing some resources and links to what Amy was referring to as well. So thank you so much. Next up, thank you. Next up, we'll hear from Claire Hannon with the Association of Immunization Managers. Go ahead, Claire.
Thank you so much, Sarah. This is Claire Hannon, Executive Director of the Association of Immunization Managers. AIM is a nonprofit membership organization, and our members are the immunization program managers in the state and territorial health agencies. So I'm really excited to be with you today and just wanted to say thank you for everything that you all are doing out there to increase flu coverage rates. CDC just talked about the additional doses that have been ordered, and I wanted to talk a little bit about additional supplemental funding that was provided to state health agencies and what they're doing with it. So there is really an increased focus on raising flu coverage rates, and some of the things that state health agencies are doing, large communication and outreach campaigns. So traditionally not an area for adults where public health has been able to focus resources, but really working on that this season, getting social media messaging out, getting targeted specific messaging to communities, focusing on healthcare workers, focusing on populations where we have disparities, focusing on vulnerable communities. So many states doing communication and outreach campaigns. Hopefully you're seeing that. I know I live in Maryland, I'm seeing it here. It's very encouraging. Also states doing more specific vaccinations and perhaps doing supplemental clinics, strike teams. We're hearing about flu strike teams with nurses in South Carolina, drive-up clinics in Virginia, and I know here in Maryland they invested in some IT solutions to roll out where vaccine is and encourage scheduling in order to have clinics where they're most needed. So these things are really great. We don't ordinarily see them. So I wanted to also mention about the 9.3 million doses. So these doses you would have been pre-ordered through the state back in July, and they will be coming later in the season. So I think it's really important to note that Amy just talked about extending this season, and that is a focus at the state health agency level too. This messaging around getting vaccinated will really be pushed out into November, December, January, when these additional doses will be coming out. A couple of other things. I wanted to mention that we are not hearing any concerns about supply. I know that we had gotten some inquiries from the media. As far as the public supply and what comes in, for the Vaccines for Children program and any additional doses, and then these additional 9.3 million doses coming later, we're hearing that's kind of on schedule. So there may be spot shortages in the private sector supply, but we've been encouraged by what we're hearing from our members about supply. And then finally, I just wanted to update on the COVID-19 planning, just to mention that, yes, it's flu season. It's also a big time preparing for COVID-19. And so the health departments, I know you all too, stretched very thin. So the COVID-19 jurisdictional playbook was released by CDC in September, and states are preparing their plans based on that guidance, at least interim plans submitted to CDC tomorrow. So it's just a very busy time. If anyone has, wants more information or contact information for how to talk with or work with your public health agency, please reach out to me. We were really pleased to do the joint letter with NAC, and want to continue to be helpful and be a resource for you. So thanks for having me. Really looking forward to hearing from those who are on the call talking about what they're doing, and always available to help or answer questions. Thanks.
Thank you so much, Claire. Thank you for adding on to what Amy said about the 9.3 million doses. Claire's contact information will be made available after this webinar as well. So if you want to learn more from her and what's going on, you can do that. And again, as a reminder, if questions arise for any of these speakers, please go ahead and start putting them in the Q&A. We're always happy to take questions, even though we'll stress them at the end. Next up, we have Jennifer Joseph from the Bureau of Primary Healthcare to give us some updates on that side. So Jennifer, go ahead. And next slide.
Thank you, and greetings all. I'm so happy to have just a few minutes to talk with everyone today, and to thank NAC for the focus on this timely and critically important topic. And particularly this focus on what we can be doing now to prepare and bring lessons learned and leverage the expertise of our frontline nurse experts. Over 19,000 health center nurses are experiencing the day-to-day of COVID as intimately as any other segment of the health center workforce, and frankly, the healthcare workforce overall. You all are heroes. And I'm not sure there are words that can fully express how health centers and nurses in particular are and deserve to be appreciated in this space. And I know many of you have heard Jim McRae, his phrase of "I can't thank you enough," and it just really does feel very much like a truism in this space as it ever has been. And so can't thank you enough for what you're doing and how you're preparing to bring us into the future and in service of the population that otherwise would be in a very different position for your being there. And I'm not telling you anything you don't know, that health centers are going to be instrumental in many ways we can anticipate, and if past is prologue, in some ways that we have yet to discover, and we're really committed to being on that journey with you together. And so our partnership with you is key in that space, but certainly in the space that we're talking about today, partnerships at the state and local level will be critically important as we're leveraging and learning from successes and challenges that you've had in the space of working with partners differently in COVID. And I'm really interested to hear more from our nurses and how those lessons could be brought to bear. Before I depart, I just wanted to give some highlights of a survey that we sent out to the primary care associations at the end of September, and we asked them to give us some top-line feedback related to flu vaccination and preparations for COVID vaccines. We just wanted to hit some of those high points for you. And so one of our questions was, where are health centers with respect to flu vaccination and relative to last year? And the PCAs let us know that it's a little too early to say if rates are higher or lower because most of those vaccinations, occur in October, November, and we're still early in that process. As Claire alluded to, clearly you all are busy, actively engaged in flu vaccination, including using mobile and drive-through clinics. We heard that health centers, at least through the PCAs, have reported having or anticipating adequate stock, and Claire has talked about that as well, with some delays due to hurricanes and wildfires, but either having adequate stock or anticipating adequate stock, so good news there. And then still hearing some challenges related to, the limiting factors around flu vaccination, challenges in spaces where health centers are still not operating at full capacity, challenges related to school-based health center closures, and patient hesitancy for in-person care and a reluctance to come in person for these kinds of services. And then in the space of COVID vaccination, as we've just discussed, state plans are due to CDC tomorrow. 31 out of 46 PCAs or health center staff reported that they were part of those state distribution planning efforts and advisory committees. So that is great news, and will hopefully translate into real actionable plans where health centers are well positioned to support that public health response. Suma Nair and I had the opportunity at ASTRO's request to talk to the state health officers earlier in the week, and they have some questions about, our health centers, like where are they with respect to wanting to and enthusiasm in being involved in this space, and we assured them, yes, enthusiastic, and if a PCA is not at your table, get them at your table. And so I think the setting is ripe for the kind of collaborations that have been built over time, strengthened over COVID, to continue into the space of COVID vaccination. And then lastly, just some of the challenges. I don't think any of these will be particularly surprising to anyone, and certainly are pending, what ultimately the state plans look like and health centers' roles within them. But, in the space of cold storage and sub-zero storage capacity, challenges there, questions about PPE and supplies to administer vaccines, concerns about staffing for mass vaccination efforts, and are health centers really going to be able to show up as much as they may ideally be needed to show up in their community in that space? While the COVID vaccine is anticipated to come at no cost, there are costs of administering the vaccine, and so health centers have expressed concern in that space. And then certainly the challenge around vaccine hesitancy, both for patients and providers. And lastly, immunization registries and the need to have a good line of sight, especially given that the likelihood of 2 doses for many of the vaccine candidates. So those are some high-level talking points or takeaways from the survey. I think the good news is that you all are at the tables and getting ready and are in the mix now with flu, and going to bring us forward into the space of our somewhat unknown future. But again, can't thank you enough for what you're doing and what you're preparing to do. Thanks.
Thank you so much, Jennifer, for that great overview. It sounds like, again, having that survey, really keeping track of, what's going on, as things often change very quickly around here. But, we're so grateful to your leadership and guidance in those areas. And I'm sure as questions arise, you know, you're going to answer those or take those back to those that you work with as well. So thank you for that. Next slide, Liz. Moving forward, we have 3 more speakers. We have Mary Blankston from CHC Inc., Anthony Fortenberry from Callan Lord, and Nate Pena from Esperanza Health Center. If those names sound familiar to you, they also presented at our most recent conference, the Community Health Inc. Expo, or CHI, as they talked about the leading models for nursing in general. And so we just had to have them back to talk about some of the different models and approaches to both flu and COVID vaccine preparation. And again, this term of microplanning, so taking, you know, the big plan that's out there, but actually making it logistically possible for both immunization, but also, you know, patient safety, team-based care, and all of those. So we've asked each of them to take a little bit different approach in sharing what they've been doing in their health centers. So we will start with Mary Blankston from CHC Inc., and she'll take you through the model that they are doing there. Thank you, Mary. Over to you.
Wonderful. Thank you so much, Mary. Next slide. Great. So for those of you who may not know who Community Health Center Inc. is, or understand maybe the size and scope of our organization, we are the largest federally qualified health center in the state of Connecticut. We serve a little over 100,000 patients per year at our 16 primary care hubs all across the state of Connecticut that are represented on the map. But we do have more than 200 service delivery locations if you include all of our school-based health centers, healthcare for the homeless sites, and other mobile locations. So certainly a very large operation, and in my role as the Chief Nursing Officer, it certainly makes things a little bit complicated as we're thinking about these larger implementations. We also have our partner, the Weitzman Institute, that is our formal research and development arm that really supports all of the work that we do and in our thinking about learning from other best practices, as well as sharing some of our own lessons learned to make sure that that rising tide can really raise all boats. So thank you to NAC for inviting me here today. I'm always happy to share the things that keep me up at night, the things that excite me, the things that sort of keep me dedicated to the mission that we're all dedicated to every single day, which is serving our communities. Next slide. So I wanted to start today just by sharing a schematic, and I realize it is a little small on the slide, so I apologize for that. But basically, what we did is exactly actually what Jennifer Joseph was talking about just a moment ago. So when we started to think about this year's influenza campaign, we really wanted to use everything that we were learning about influenza delivery to translate that over into what we were then going to need to do with regard to COVID vaccinations. But we were very concerned as our model had really changed to the majority telehealth, and even to this day, only about a quarter to a third of our care is currently delivered on site, and the rest is actually being delivered via telehealth. So knowing that the majority of our flu vaccinations were actually delivered in an incident to encounter within a provider visit, it was very concerning to me that we weren't even going to be able to meet last year's dose requirements. So huge shout out to our Business Intelligence Department and Nick Seabury and his leadership as the director of our Business Intelligence Department, who built this wonderful dashboard. And the bottom bars is actually our 2019-2020 flu season. And what you see on the top is actually our 2020-2021 flu season. So I could actually have that comparison year to year, as well as 2019, we've projected out 2 weeks so that I can really think about what's coming down the pike in terms of typical surge that we see flu season to flu season in terms of the numbers of doses that we're giving. In this schematic, you also notice different colors. So the orange color actually represents the incident to vaccines that are given within the context of provider visits. Then the red color is actually flu vaccines that are given within the context of independent nursing visits. And then this year we have a new color, which is our blue bar, which represents our high volume drive-through flu clinics. Again, in an effort to really capture the success of our implementation. So most of those blue bars, starting from the very beginning, maybe only started with 50, 60 doses a day, all the way up to last week and this week being somewhere between 200 and 300 sort of outside drive-through flu vaccines being given at any given time. And when I look at our overall data, since the beginning of this year's flu season, we've delivered a little over 13,000 flu vaccines, which is about 83% of where we were last year. Now, way back at the beginning, we were actually only having delivered roughly about 60 to 70%, so we have slowly been catching up to what our numbers were last year. And my goal before hopefully the end of the November month is to actually catch up to 100% of the number of doses that we have given last year. So again, really just making sure that you are thinking about data, that you're setting goals for yourself and for your team, and really kind of monitoring this stuff day to day. Right now, we're actually doing some refinements to this so we can drill down to sites to really think about where we can identify best practices, as well as maybe where we need to do some additional booster training, or think about whether that population maybe needs a different communications campaign with regard to vaccine acceptance or other issues. Next slide. So when we think about kind of translatable lessons learned, so what are we learning about flu that we can actually then translate to COVID vaccinations? I think we all know from the very beginning that with vaccines in general, ongoing and frequent patient education is very, very important, and you have to start now. Even though you don't have flu vaccines, don't have COVID vaccines, even though you don't know when your COVID vaccines are coming or which COVID vaccine you're going to get, you have to begin to inform your patients that, first of all, great job coming to get your flu vaccine, but please make sure that you stay tuned to whether it's our Facebook page, our Instagram page or Twitter or wherever you hear about the things that we're doing, our campaigns. When COVID vaccine becomes available, please stay tuned. We want you to be able to engage and come and get your COVID vaccine. So thinking about how to explain those things now is important. We've actually had patients who have come to our flu clinics and already been a little bit confused and thinking that the flu vaccine maybe covers COVID or gives them some protection against COVID. So there's already some misinformation that is out there. I think we know that that is kind of rampant everywhere, when it comes to vaccines just in general. So educating and really engaging and listening to patients about the things that they're worried about, the things that they're concerned about will really go a long way to make sure that you can increase the vaccine acceptance of your population when COVID vaccines actually get here. Ongoing professional development will be very important for your vaccinators, not only just to make sure that, they actually feel supported and feel like, they're really on top of it and they want to support me with everything that I need to know. But that way they can also think through what are the things that we feel like we need more of, or in addition to what we already know and what we already feel like we're experts in before we get these COVID vaccines. Staffing needs, of course, as I'm looking at the volume of vaccines that we're giving, I absolutely am aware of the pain points and which sites are really struggling because maybe they have too many patients coming in for vaccines and the nurses are having a difficult time keeping up for it. So that gives me some idea of how maybe I need to staff up to not only accommodate the increase in flu, but also think about accommodating COVID vaccinations. The reality is that we're all going to be giving flu vaccines at the same time as we're giving COVID vaccines likely in the spring. We have to be prepared for that. And also, I think just in general, a translatable lesson learned is just keeping yourself at the table, sharing successes with your flu campaign. Make sure to bring data, right, so that people will listen and understand the things that you're worried about because you can show them. And it's not just with state and other leaders. You want your states to know, look at what we're already doing. We've delivered this many flu vaccines in this short, amount of time. These are the best practices that we've developed. That will really encourage your state leaders to know that, you're really working hard and that you want to be a part of this solution. And that will keep you at the table and keep you as a part of this larger conversation. And then, of course, with your own leadership teams, too, right? There's lots of things that go into vaccine delivery. And at times, I think, other leaders may kind of misunderstand maybe the amount of time it takes to give a vaccine or what the needs are of the staff who are giving the vaccines. And so it's your job to make sure that you're at the table to advocate and, as I said, to share that data and tell the story so that the needs can be met and we can better tackle the issues. And of course, this year, I think we've all learned that with our flu vaccine campaigns of proactive outreach, or proactive campaign is definitely more successful than a reactive one. The years past, patients would certainly just come in for their appointments and we could just, offer it to them when they were in the office. But now we really have to campaign and communicate and tell our patients, we're here, come see us, and leverage other things that we're doing in high volume. For example, COVID testing. So we've actually incorporated our high volume flu lines with our COVID testing lines so patients can actually get both services at the same time. And maybe people who weren't even considering getting a flu shot will now consider because they're already in line to get a COVID test done. Next slide. But of course, we have to address the unknown. And, as a mother of two girls, of course, thinking about the unknown is very important and always brings up Elsa's voice in my head of, just trying to fiercely going into the unknown and trying to be as optimistic as I can about really just being ready and prepared for what's coming our way. So really making sure that I'm tracking the science and sort of the race to the market. There are basically 3 vaccine frontrunners at this point, but you never know, things might change. And 2 out of the 3 vaccine frontrunners are 2-dose series, and so again, being prepared and ready for those things. We want to be prepared for any vaccine. So that means multiple contingencies. What's the data and information that we're going to need to put the vaccine into our EHR? What are we going to name each one? How are we going to enter that? What are, the codes that we have to associate with it? Let's update our standing order. No matter which one, we can just plug in the name when we learn about it, but we have everything else ready and prepared to go. Thinking about templates for when your nurses are giving these vaccines. If they're doing independent visits, there's a host of education and other things that you're going to want your nurses to go over, but please make their documentation process as easy as possible. Then think about additional storage. I know the recommendation right now is to not purchase ultra low, but we do have to be prepared and understand that there is the slight potential that there might be a vaccine that comes that may require that. But again, you're likely to need additional refrigerators as well. If you are getting more of these flu doses and the flu season is lasting longer, you have to potentially be able to store more vaccines. So most offices, I think, are, investing in potentially, an additional refrigerator, additional data loggers, just so they're ready. You already will have to replace your fridges at some point, so it might just be an investment for the future, but better to be prepared. And then think about limited vaccine release. There is the possibility that, we may not get large quantities at a time. You may only get 100 or 200 doses. So what do you do? Like, how do you identify your priority populations? And how do you make sure that you have a second dose process? I think you can oftentimes leverage what you're doing for your pediatric population, that many of them will require a second flu dose. So whatever that recall or population health process is, that's what we're planning on using to support making sure that these patients will get their second dose. Next slide. Training needs. What if we get a multi-dose vial? What are the additional things that our nurses are going to need to be reminded about the infection control things, issues like that? If the needles are coming in the boxes with the vaccines, what if it's a completely different safety needle? There's a possibility that you might see a rise in needle sticks, not because the needle is of poor quality, but just it's different than the typical safety needle that you're currently using. And again, your side effect monitoring or VAERS reporting might look a little bit different. So again, making sure that you have contingency plans and sort of checklists for yourself to make sure that you're on top of all these issues. I have listed some other suggestions below here too on data plans, things that you should be thinking about tracking, not just the numbers of doses, not just ticking and tallying sort of the second dose, but also really trying to understand if you're a larger organization and have multiple sites, you might have a site that is struggling with vaccine acceptance while another site is really successful. So make sure that you're learning from each other and identifying where you may need extra campaigns or extra support. And then, of course, patient satisfaction. There is you can learn so much just by hearing from patients, asking specifically if you're already calling them for other, information and satisfaction data to see, oh, I see that you got a COVID vaccine today. How was that experience for you? So just being prepared that those workflows are built in. Last slide. And lastly, think about your staff. Are you going to offer the vaccine to them, or how are you going to make sure that your staff have access to this? And just in general, how are they doing? How are they managing their stress and responsibilities? And frankly, how are you doing as the nurse leader that's really supporting what they're doing? Are you able to bring your optimism and grit every day? That's kind of my motto, is that I have to be optimistic and I have to be gritty to be able to handle anything that comes my way. Because remember, you have to think about yourself too, because your staff needs you. So you have to take care of yourself in order to be able to take care of them. You need to communicate with them and inform them of what's happening often and with the highest level of transparency. And then be their advocate with data, and also be that truth speaker when sometimes their perspective needs a little bit of shifting. I know we all complain once in a while, but when you can bring data and show them, like, you know, you may feel like it's really bad, but look, we're doing so well, and this is what's happening. You know, there are often times where you can, you know, tell a very long and amazing story with just a few numbers. So please make sure you're also thinking about your staff. Sarah, I'm going to turn it back to you now. I think the other two speakers are queued up.
Yes, thank you, Mary. Thank you, Mary. I think you've given us a good theme for Year of the Nurse 2021, which is nurses bring optimism and grit. I love it. Thank you so much for that. Again, please forward any questions. I'm sure many of you may have a lot of them after her presentation today. So next up, we have Anthony Fortenberry from Callum Lord, who's going to share. So let's go ahead, Anthony. Make sure we can. And we cannot hear you. Sadly, I think your audio may be off. So why don't we work, we will work on that. Why don't we actually go over to Nate Pena, and we'll work on the audio, and we will come back to you, Anthony, no worries. So Liz, if you could queue up Nate Pena. So Nate Pena is from Esperanza Health Center, and we'll share what's going on at his site. Go ahead, Nate.
Hey, how's everybody doing? My name's Nate. I'm one of the registered nurses at Esperanza Health Centers, and I'm happy to be here today to talk a little bit about Esperanza and what we're doing as far as flu vaccines go, and about thinking towards the future. So next slide, please. So some demographics. We are a federally qualified health center located on the southwest side of Chicago. We do have services for adults, adult care, pediatrics, women's health, behavioral health, and psych, and there are 4 locations. Each of our locations can bring on, you know, unique little challenges. We do primarily serve a Spanish-speaking Latino population. We serve around 35,000 patients a year. That number should be going up based on, you know, hiring additional providers. And so we're looking at about 100,000 visits on a yearly basis. Most of our patients are Medicaid, 60%, with about a third of our patients being uninsured. And so having, you know, a third of our patients being uninsured brings some challenges. 10% are commercial or Medicare. Across, we have 210 FTE, but I feel like that's a little bit more based off of the emails I get for the new staff that are being hired. So that number's probably increased. And then also for national quality, we have also received a lot of different national quality leader awards. I know that we recently just got Million Hearts for hypertension control, and our chief medical officer was able to speak at the U.S. Surgeon Attorney General's call to action to stop hypertension. So that was pretty awesome to see. Next slide, please. So demand for flu vaccine, we have seen an increase in shots so far this year compared to last year. And, you know, Mary did mention the great data slide that she had there. And I think that that was something that when I was discussing this along with one of our managers in quality and practice transformation, we were discussing that denominator, what it looks like now that, you know, telemedicine has been incorporated and a lot of patients are, and some of these visits are occurring off-site. You know, how is it that you're able to gather this data and best represent it? We have seen a percentage increase of the patients that received a flu shot and had an in-person visit. So we've seen an increase of 43% to 59% between last year compared to this season, given the same amount of time frame, which is mid-August up until now in October. So that's a positive thing to see. And then as far as demand goes, just based off of what patients are saying, I have gotten a couple inquiries about it during my nurse visits. Most of my work is centered around diabetes education. I'm actually scrubbed up and ready to go for the flu vaccine drive-through that we're actually doing today. And I'm going to go step outside and get ready to handle that. So I'm sure I'll hear a lot more, but patients have been inquiring about it from my end at least. Next slide, please. Acceptance on vaccine. This is a good one. I think I spoke with a couple providers on site, kind of get a little bit of their perspective as what they see. It's a little bit of a mixed review, and I feel like it's a mixed review even for prior to COVID, when I was actually helping out community health workers, in which I was helping them with a curriculum of nutrition, and one of the topics was addressing vaccinations, and it was about 8 to 10 women that would go to schools and provide education, and we had a session on vaccines, and I would say it was split 50-50 based off of those that felt, that they should be getting vaccinated, and others that, may have had different experiences, and so they didn't feel the need for it. So that's kind of remained the same throughout. Speaking with some of the providers, pediatrics expressed the same thing as well. A couple adults did say there was an increase in administration this year, and one of those reasons why is we've been able to work out with CDPH, Chicago Department of Public Health, to give free flu shots for our adult patients, specifically those that are uninsured. And so I think Esperanza has done an amazing job serving patients that are uninsured. I know for the diabetes aspect, we've also done continuous glucose monitors and find a way to tailor that to them as well. So with the flu vaccine, and having this be free, we're at least reducing some of the cost barriers that are put in place with acquiring or getting the vaccine. So next slide, please. Overall, our supply is pretty adequate. We have agreed to accept assistance and donations from any other entities, and that have offered or expressed interest in assisting us. There's a couple of organizations that are currently being worked with, Esperanza is, to continue the supply. And of course, children are receiving flu vaccines covered by the city of Chicago. And as I mentioned, it helps to get an additional surplus specifically for those that are uninsured. So supply looks pretty good, and it sounds like from the slides earlier mentioned, or from the presenters earlier mentioned, that an additional 9 million vaccination doses will be available, so that'll definitely help out. Next slide, please. Some of the potential challenges. Well, I know what we're experiencing, and apparently it's been said that there may be a shortage of needles, which is a little bit concerning. Mary touched on this a lot, especially when we're looking at needle sticks. And so I know that when I actually did a staff flu vaccine drive-through, one of the concerns, and it's very detailed, it's very intricate, right? But it's how do I cover this needle? And so if you have a patient in the car and you're going to get ready to inject them in the car, how much is exposed to that shoulder, that deltoid for the injection? And then normally if you're going to cover a needle, you might use the bed to cover the needle, or you have a retractable needle that you can push on, which is easier. But depending on your needle, you need to use the surface to cover it. So now, your options are a little bit limited. You might have to use your thumb now, which if you use your thumb, you increase your risk of potential needle stick. And so then you have to go through, the whole ordeal of what that means when you do get it, flushing it, letting supervisors know, getting labs done. So those are some potential challenges that may be seen. I think beliefs in the media, I know I love the population I serve. There are a lot of myths that go out there, and the media has a big influence on what our patients do. So that's going to definitely be a challenge for COVID and the COVID vaccination. And then cost and access as well, which I think Esperanza is doing an amazing job of this. Hence the flu vaccines for the uninsured, and then having the drive-through, which I'll be out there. And so the idea of the drive-through is to serve those that are established patients, but also even those that might just be walking in and just want to get their flu vaccine as well. So that's definitely great for our patients. Next slide, please. Planning flu and COVID-19 vaccination. So I kind of touch a little bit on this, right? But if we're outside, there's a lot of factors to consider, temperature being one of those. You have staff out there in the heat. I know I've done some inspections for our testing site as infection control champ as well, one of my other roles. But I can see the heat wearing down on some of our patients. If you're in a different climate, Georgia, where it's a little bit hotter and during these times than here, you might want to consider that. Consideration, the tents as well, how the tents are holding up. Having a facility, we have a great facilities manager who's able to make sure the tents are rooted in correctly, that they have the appropriate weights, the walls are set up the right way, there's signs on the tents directing patients. So those little intricate things have to be thought out. Infection control practices, which I already mentioned. And I think one of the big things is making sure we're screening patients accurately prior to them getting their vaccine. So I know as we screen patients in our buildings before they come in for their visits, whether they've had symptoms, they've traveled recently, or they've had COVID results, we go ahead and we have a little workflow where we might send them to the tent for testing, or if they're asymptomatic and afebrile, they can just come in and be seen by a provider and continue on with their visit. So we have to take that model and put that outside as well. So as patients are coming up, we have to ask them that, and based off of some of the CDC recommendations, if they are symptomatic, it's best that we hold off on that. On them getting that vaccination and maybe direct them to getting tested. So you have to think of those things, especially if we're going to be doing this for COVID-19 vaccinations as well, to protect the staff. As an organization, we're looking to use pods, which are nice, the nice pods that you see. Apparently they'll be laid out very well, floor warmers, and we'll be able to do COVID testing in those pods. And also the plan is depending on the demand and how much supply we have of those pods and how the logistics work, we might use additional pods as well to serve patients with vaccination. So that's an option for the future. And then just something I think that will be important to touch on for our patients is kind of attempting to get a snippet of what their feelings and beliefs are through maybe a survey that is constructed in-house, and trying to do your best to gather what their beliefs are, because there are logistics here, no doubt. There's the refrigeration, there's storage, there's patient safety, but the ones that are getting the vaccination are the patients themselves. And I think that beliefs, perceptions is going to be one of the biggest barriers to this vaccine. And I think that if we get those surveys in and we get those opinions and get that feedback, it'll be good. So that should be it for my slides. I appreciate it. Thank you for having me on here. I look forward to hearing the rest of the presentation. Thanks, Sarah.
Thank you so much, Nate. And I love how you're scrubbed up and ready to go the minute this webinar is over. So good luck out there. Keep safe. We've gotten some good questions coming in, so we will get to those shortly. We're going to go back to Anthony. I think we have audio now. Let's try.
Hi, can you hear me?
Yes, we can. Excellent. Excellent. Thanks for your patience. See, nurses figure things out just like that. Go for it, Anthony. We share about your work at Callan Lord.
Thank you so much. I'm going to keep this super brief. I think both Mary and Nate went over so much of what we are trying to focus on at Callan Lord. Can we go into the next slide? I just wanted to touch briefly on the importance of, I think, both for flu vaccination and COVID vaccination, the continuing education of nursing staff. And oftentimes, nursing departments also include medical assistants, which I think are really important in including all nursing staff that come into contact with patients, information around the importance of immunization and specific questions that may come up around vaccination. Certainly, there's going to be lots of questions and concerns, I think, around COVID. And so ensuring that medical assistants are also able to, if not answer all questions, know how to direct patients to the appropriate resources. I think it's really important to utilize medical department leadership to partner in providing this education at all of the locations, and also to ensure nursing competencies that are focused on health literacy initiatives, ensuring that nursing staff have the skill set to be able to provide improved health literacy initiatives in every interaction that they have with patients, so that we can ensure the most up-to-date information regarding vaccines and immunizations are available to patients in real time. Next slide, please. I also wanted to just put out there that every opportunity that our nursing staff or medical assistants have with patients are health literacy opportunities. Even scheduling or confirming appointments, check-in or urgent care triage, rooming patients, these are all opportunities where nursing staff can promote vaccination and ensure that all questions that patients might have related to either flu or COVID or any immunizations are able to be answered in those interactions. I also, at Callan Lord, we're doing targeted outreach efforts to try to engage patients to come in for our vaccination clinics. And so I think that's another important strategy where you can promote health literacy in all of these kinds of transactional opportunities. Next slide, please. This is just something that I thought was really important to remind everyone about, and that is that nurses have the trust of patients. We have the opportunity to create rapport and to engage patients in a way that oftentimes other members of the care team don't have the opportunity to generate. And so leveraging that trust to ensure that we are providing information to our patients that is both succinct. You know, we have a very short amount of time often with patients, but we see them often. And so, you know, providing information as it becomes available related to the COVID-19 vaccine, as well as the importance of flu vaccination, perhaps this year even more than ever, is an important initiative for nursing as well. Next slide. Optimizing access. I'm going to go through these last slides very quickly. I know we're running out of time, and I want to make sure there's opportunity for questions. We're doing vaccine-only appointments to optimize access. So online scheduling is available, an open access model so patients can walk in for flu vaccines, as well as standing orders, which I know Mary mentioned as well as an important initiative to ensure that is available. Next slide. Patient-centered considerations. Again, we're using a population health focus to really do targeted outreach to our most at-risk patients. Also considering our uninsured or underinsured patients, ensuring that they are aware that economic barriers should not be a reason not to come in for vaccination, as well as a trauma-informed approach. So many of the patients that we care for have experienced trauma in the healthcare setting. There is mistrust of healthcare for some patients, and ensuring that is an important component of our approach in providing education and ensuring patients are empowered with the knowledge to make the best healthcare decisions for themselves. And the last slide, please. Mary touched on this as well, but I think it's super important. Our nursing staff are at risk for burnout more than ever. You know, we had at the height of the pandemic a large percentage of our workforce homesick. Even those that were not homesick might have childcare concerns that make it difficult for them to come to work on site. All of these considerations and more lead to burnout and low morale. And so, as Mary said, that is another, as nursing leaders, an important consideration and focus as we go into cold and flu season with COVID layered on top. I believe that's my last slide. I have my email on the next slide if anyone has any questions. Thank you so much.
Thank you so much, Anthony. I think, you know, each of you was able to hear, again, you know, from our experts at CDC, BPHC, Association of Immunization Managers, and then 3 nurses. We were so glad for that combination of experience. We have a lot of questions to get to. What I'd like to do just real quick is we do have a couple announcements about some upcoming webinars that I want to make sure we get to, and then we'll get to the questions. First one, October 28th from 1 to 2 is a NAC COVID-19 webinar called Leaning Into the COVID-19 Pandemic. That will be about business contingency planning, which some of that you heard today, and collective data and informatics systems. So save the date for that one. Additionally, we don't have the webinar information yet, but we will be continuing this series, and we'll have an Ask Me Anything, which is a COVID-19 vaccine overview in November, and then in December, we'll continue the nursing conversation, nurses at the front line, on kind of where we are then as things keep changing very quickly. Then if you'll go to the next slide, Liz. As I referred to in the beginning, we are continuing to celebrate Year of the Nurse. We tell stories every week and every month of nurses. So if you want to nominate a nurse, there is a link there, or you can also email me directly to nominate a nurse and tell their story. We have a lot of really interesting stories to tell, so just wanted to make sure we plugged that. So we're going to get to questions, so if our panelists can get ready to go. One of the main ones that we've heard is about immunizing non-patients, so patients that don't normally, don't necessarily belong to you. Are any of you immunizing non-patients with the flu vaccine, and what is the cost associated with that, and what are some of the workflows surrounding that? So if one or two of you want to answer that question, Nate, Mary, or Anthony, probably one of you all.
I can go ahead and start. I don't know the cost aspect of it. If I did, or maybe I'll find out later on. We are rolling it out as of today, so it is fairly new. What we've been told is that those that are non-established patients, we have a kind of a system where there's like what we call a patient service representative. There's a few members of the of the process out there, so they're going to be able to be registered with, appropriate conditions, safety measures put in place. They'll be able to be registered in the system, have some information taken, and then go on to the nurse to be screened and then have a vaccine administered and then signed off by a physician. So, and then have some of that assessment occur where we check for allergies, we ask some questions. And then one of the big things too as well that has been looked into or that we've had to consider is just the possibility of syncope with the vaccine. So there may be a need to have a declination waiver of some sort signed by staff or whoever it is you're vaccinating because of that possibility of fainting. So those are just some of the things that to think about in the whole process. And I don't have the cost, I'm sorry, but that's it.
That's okay. Mary or Anthony, anything to add to that?
Go ahead, Anthony. If you wanted to share something.
Terrible connection issues. I apologize. Go for it, Mary.
So we are giving to all CHC patients, as well as our state has really actually been quite supportive in sharing with all of the FQHCs an unattributed Medicaid list as well. So we are not enrolling just any non-patient, but specifically the unattributed Medicaid population in an effort to really make sure that we can connect these patients to primary care and to make sure that they have access to not only the flu vaccine, but also to COVID vaccines and other services when they become available. So we have, very specific communication campaigns to do that.
Hi.
Excellent.
We're in a similar situation and certainly are focused first on our established patients, but are going to do the same in making sure that it's available with a focus on uninsured patients as well.
Excellent, thank you. Our next question, and then this is kind of a two-part question that any of you, our health center panelists can answer. It is about safety precautions during drive-through clinics. So are there clinics providing drive-through flu shots and a COVID-19 testing? What precautions are you taking while you're immunizing people in cars? And then there was actually another question that kind of goes along with it about, there's often a policy around waiting, having a patient wait 20 minutes after any injection, and how do you get around that or address that when someone's driving up for a shot? Who wants to take that one first?
So we are delivering flu vaccines alongside our COVID testing clinic, and that actually has been some of our strategy. Again, our physical plant space doesn't really give us the opportunity to have so many parking lots for big drive-through lines. And frankly, our COVID testing is attracting close to about 7,000 people roughly per week for testing, which is pretty significant. So we're trying to leverage that for any of our patients who are coming for testing to say, hey, while you're here, let me do what I can for you. And the way that we've kind of gotten around sort of separating the two is, of course, the vaccinator does have to have access to Wi-Fi. And so our testing portion of the clinic is further down the line than registration and then actually placing the requisition for the lab order for the COVID test. So the flu vaccine is actually delivered while the patient is being registered and the requisition is being placed for the COVID order. So the nurse does their own independent process, although the registration person helps to identify whether the patient is eligible for the flu vaccine, then the nurse will go and offer it, deliver it, and then the patient will go to the next tent, which is where the actual specimen collection takes place. In terms of sort of and it's actually a 15-minute wait period. That's something that's recommended by ACIP and CDC. And so what we have typically done is we actually give a card to the patient and say, you need to wait in this vicinity until this time. And should you have any reactions or whatever, please proceed up to our front door. And we have an entrance screener right there. So again, some patients may choose not to wait that full time, but we do inform them, of the potential risks, and we say, please stay within this vicinity. We're right here. Once the clock hits this time, in your vehicle, then you're free to go. Again, we really put the onus on the patient to make sure that they can, be in the area should they need assistance.
Thank you. Thank you. I hate to interrupt, but we are at time, so I want to be cognizant of everyone's time. For those of you who want to stay on, our panelists, as they're able to, can stay on a couple extra minutes. If so, but I just wanted to give a huge thank you to our speakers today. Again, just a wealth of knowledge and experience and spirit. And what was the optimism and grit amongst all of our speakers. So thank you so much. For attendees, a transcription of the webinar and a recording will be on NAC's homepage in the next couple days, along with the slide deck. We'll also be compiling some resources that were mentioned today from all of our speakers. And always, see the CDC, BPHC, and NAC websites for any resources that you need. If you have any other, further questions or any comments, about this webinar content, you can also reach me at sprice@nac.com. I'm happy to filter questions there. Again, we will stay on for a few minutes if there's some additional questions, but thank you all again for joining us today, and we look forward to having you join future ones. Thank you.
I'm available to stay on for a few minutes if there are any questions or any is still on.
Excellent. Yeah. Might as well. Nate, go immunize some people. Thank you for joining.
I would love to stay, but I'm gonna get out here and do some work.
That's okay. Yeah, we have some follow-up questions for you directly, so we'll send those over. Thank you, Nate.
All right. It was great doing this. Have a good one.
Thank you, Nate. Excellent. Yeah, we got some feedback about, Mary, similar to you, having patients wait 15 minutes. They have reserved parking spaces to wait while they do that. One of the questions that arose was on the use of medical assistants versus nurses because they don't have nurses. So do these same elements apply to medical assistants? I think both of you alluded to that, but any other further comments on that question?
Yeah, I saw one of the questions about, I do acknowledge, I think a lot of organizations have medical providers overseeing their medical assistants. At our organization, medical assistants are overseen by nursing staff and are a part of the nursing department. And so I think they are a very important resource for nursing care. And that model where we have LPNs, RNs, and MAs working together under one department as part of the care team has been very successful for us.
Yeah, and similarly with Anthony, here in the state of Connecticut, though, our medical assistants are not allowed to give any amount of medication, so we have to use nurses, but certainly I do think and really subscribe to the model that Anthony is describing. Our medical assistants are extremely helpful, but in the moment that we're giving flu vaccines outside, should a patient need help and support, having some nursing out there to triage the patient and to assess the patient and to quickly get help is definitely very helpful. Sarah, I did just also want to comment on the reserved parking spaces, and I think that is great. I mean, if they have room if you have room in your parking lot to do that, I think that definitely is a best practice. I think if you look at the research, the risk for fainting definitely is higher for like adolescents and up to adults. So again, we typically, of course, would emphasize this, particularly when we're vaccinating the driver. But again, I think depending upon your location, you may or may not have actual space in your parking lot to manage the number of cars. And so that could potentially present a challenge. So again, part of that microplanning is making sure that, you actually go out and look at your parking lot, think about how many patients are coming in person, what would the flow of the cars be, where could they park, are there going to be traffic jams, things like that. Is it going to back up on the street and then you're going to get in trouble with the police department or the fire department or other people? Those things are very, very challenging and not things that I typically as a CNO worry about, but I've really had to be more engaged in.
Absolutely. Thank you for that. Thank you for that. That was all the questions. I think, people want all the resources. Claire, the question about the, and to Amy as well, the COVID-19 playbook that came out. So we'll be pointing people in the direction of all the resources that we had. But I think we've addressed most of the other questions. So thank you all again. Thanks to our panelists. This is not the end of us seeing you. We will do more. Thank you all so much again for attendees at home.
Thank you.
Thank you so much.
Thank you so much.
Thank you, everyone.
Have a great day. Be safe.